This one shows more things.
Don't mind me, the burn on your shoulder.
That's okay. I'm going to use other ones too. Okay, this one just happens to show more things on it. And I can't guarantee I'll catch everything because there's quite a few things to know. Okay, but basically we're looking at this right here is the myocardium. This is the heart muscle. Okay, I'm not going to ask you epicardium, the outside of the heart, or the endocardium inside the heart, because it really doesn't show well. But I will ask you this. What is this tissue right here? This is the heart muscle. Thursday when we go through the layers, we're going to find this is the muscle layer, this is the myocardium. Myo is muscle. Okay? Looking at the outside, again, be very careful with red and blue. Red represents oxygenated, blue represents deoxygenated. It doesn't always represent arteries and veins. Okay? An artery heads away from the heart, a vein comes back toward the heart. Not every artery carries oxygenated blood. When we're leaving the heart from the right side going to the lungs, we're going to be going through blue arteries. We're heading away from the heart, therefore it's an artery. We're going to the lungs to get oxygen, so they're going to be blue. They're going to be represented by deoxygenated. When we come back to the heart, to the left side, we're going to be coming in through pulmonary. Pulmonary is lungs. We're going to be coming back through pulmonary veins. But look at these veins, they're red. They're coming back to the heart from the lungs. They are very oxygenated. We just got oxygen from the lungs. They're going to be nice red but veins. Okay? Sitting on top of the two upper chambers, the atria, are the auricles. The auricle actually means ear, and it kind of looks like a dog's ear hanging over here. They're actually just a little extra container that adds a little bit more blood volume to each atrium. A lot of people go and take this side and just throw it away. I do ask you on this one things, okay? And people get confused. You can always pick it up and turn it over, but I always right away look at this right here. This thick wall is going to be on the left side. So right here we know this is the left ventricle, the right ventricle, left atrium, right atrium. We also want to see here this valve. This valve is going to be where the blood from the right side is leaving out through the pulmonary trunk. The pulmonary trunk is the name for the first part of the pulmonary artery. This is heading away from the heart. This is how we get to the lungs. Blue artery. Pulmonary trunk, pulmonary artery, same thing. A lot of times a big artery or vein where it starts, we call it the trunk. Then it branches just like a tree. But pulmonary artery would be acceptable for that. Okay? Over here we have, again, I look right away at the wall thickness. I know this is the right side, thinner wall. Right atrium, right ventricle, left atrium, left ventricle. The valves have flaps we call cusps. The cusps are attached to the papillary muscles by way of the chordae tendineae, the fibrous cords. They're attached then to the papillary muscle, and then the walls of the ventricles are very muscular, but they've got these convoluted network of muscles in here, the trabeculae carneae. Okay? Over here, just quickly, I like to study the heart by the way the blood goes through the heart. That's one of the best ways to study it. Our deoxygenated blood is going to come back to the heart now. Okay? It's coming from the top of the body through the superior vena cava, superior top, the top big vein. Lower part of the body, we're coming in through the inferior vena cava, so that covers the upper part of the body, the lower part of the body, and we can't forget the heart itself. The blood that's been around the heart now has to go back to the heart and get pumped to the lungs. So we come in through a cardiac or coronary, same thing, vein. This big vein has a special name. This is the coronary sinus. The sinus is just a cavity. So this is a big cavity. This is a vein. So now we've got all of the deoxygenated blood coming back to the heart to go to lungs. Top of the body, superior vena cava. Bottom of the body, inferior vena cava. Heart itself, coronary sinus. And they all come into the right atrium. From the right atrium, we go through a three-flap, three-cusp valve, the tricuspid valve. We now come into the right ventricle. From the right ventricle, we're going to go out through the pulmonary semilunar valve. Somebody thought the cusps here, the flaps, look like heart moons. It's still another three-flap valve, we just don't call it a tricuspid like this one. So this is the pulmonary semilunar valve. Now we head out through an artery, blue, pulmonary trunk, pulmonary arteries, and head to the left and right lungs. Once we get to lungs, we get oxygenated. Now we're going to come back as red, but veins, we come back through the pulmonary veins, okay? This is going to bring us back into the heart, and this is going to bring us to the left atrium. Okay? So right side is just for going to the lungs. Once we come back with oxygenated red blood, okay, by way of veins, coming back to the heart into the left atrium, we go through the only two-flap valve, the tricuspid, also called the mitral valve. From there, we come into the left ventricle. From the left ventricle, we go in through another three-flap valve, but this one's called the aortic semilunar valve. Right here, very important, the first branch. Everybody thinks when I ask you what's the first branch off the aorta, they think here. No, the first branches off the aorta are right here. This is for the left and right coronary arteries. And so these are going to come out and feed the heart. The heart feeds itself before it feeds the brain or anything like that. Okay, this is the ascending aorta, arch of the aorta, then we descend behind the heart to go to the lower part of the body. Okay. Over here, this we'll talk about when we talk about circulatory routes. This used to be a connection from the pulmonary trunk to the aorta, and now it withers up and becomes a little connective tissue remnant. This is the ligamentum arteriosum. Over here, we can see the remnant of what used to be a hole between the two atria when we were a fetus. It seals up and stops being a hole. It's now a little fossa, a little dent. This is the fossa ovalis. On this here we can see, can't actually see it, so they just paint it as green. This is part of the pacemaker conduction system of the heart. This is the SA or sinoatrial node. This is the atrioventricular or AV node. We also can see here the left and right bundle branches, and then wrapping around the ventricles we can see the Purkinje fibers here. This is all part of how the action potential gets to the lower part of the heart. We're going to have action potential again. And so this is all part of the conduction network of the heart. Purkinje, just named after the same scientist we saw back with Purkinje cells. You got it. Okay, let's see what else. Over here, on the front of the heart, this is the sulcus here, and in the sulcus is a major anterior interventricular artery. The two ventricles are here. This is the interventricular artery. So all of these on the heart here, the red ones, we can say red, are arteries in this case because this is systemic circulation. Again, we'll get into that. But these are our different coronary arteries here. We've got circumflex and everything. I just don't hold you for all of those. Once we feed the capillary beds of the muscle with the oxygenated blood, now we come back through coronary veins and all come back to the coronary sinus to do it all over again. What else? This is the apex of the heart, just the ending there. I don't ask you that, but a lot of people ask about it because it's in there. Do know the branches off of here, okay? What people don't like is it's not symmetrical, okay? This is brachiocephalic, is that right? And then we have carotid and subclavian. I haven't done this in so long. This is my first time doing it. I got to refresh my mind myself. Just be careful with these because they're not symmetrical. This one here will later branch to what these two have already branched into. Not sure if they're on the pick list, but they're good ones to know. Even if they're not on the pick list, they're good ones to know. Can't think of anything else offhand. I think that's most of it. All right, that's a long one.
Pushing 10 minutes.
Wow.
Thank you.
Oh, thanks, Mr. Armstrong.
My pleasure.
That's why I'm not sniffing all right.
These three
Got
right
it all
here.
under control now. And can you read?
Oops, sorry.
Did you not? You know what?
I'm trying to remember for myself here.
Okay.
Let's
It's not a big deal.
look. No, let me just take a look. I just want to make sure I'm right.
I was in pick a sense if I just wanted to finish recording this.
Yeah, brachiocephalic.
Oh,
yeah,
no,
what's the
okay.
flavor? So brachiocephalic, left carotid, left common carotid, left subclavian. What's going to happen is, what does brachiocephalic mean? Brachial is arm, cephalic is head. Well, this is the left common carotid, that's going to the head. This is the left subclavian going under the clavicle, going to the arm. This is brachiocephalic, head and arm. It's going to branch into the right common carotid and the right subclavian. So almost think of it as, this hasn't branched yet, this already has. So in a way it is symmetrical. The first branch, if they extended this a little bit more, that would become the right side of these two.
Is that the
So it just
aortic
has,
arch?
yep, off the aortic arch is brachiocephalic, right, brachiocephalic, left common carotid, right subclavian.